Welcome back to the Fertility Confidence Podcast. We are having one of my most favorite conversations today. And it is a conversation that I honestly think every single woman who is trying to make a baby should be having, but isn't having, or isn't having until you're $30,000 into IVF and it's still not working. And so if you've listened to the podcast for a while or you follow me on Instagram, which if you don't, come hang out with me at Fertility Confidence Method, you'll know by now that that's just not the way we roll over here. We're not waiting for multiple failed attempts of expensive procedures to actually start to dig deeper and get legitimate answers as to why this isn't working. So if you are someone who has had multiple failed cycles of medicated cycles on your TTC journey and you still don't know what's wrong, or you've been told you have unexplained infertility, or you're having recurrent miscarriage, this episode is something that can open the door to a whole nother journey that might unlock exactly what's going on for you. And the more we talk about it, the more I think this is going to start to gain traction in the fertility space. Hopefully we'll see only more and more and more research. So let's get into it. We're going to talk about why the uterine microbiome is this unsung piece of the fertility experience. We have talked a little bit about the microbiome before on the podcast. So a quick little piece being that we used to think the uterus was a sterile environment, meaning no bacteria whatsoever. What we all generally know about the human body is that we have bacteria in our gut, right? Like you don't need to be a medical professional to have found that sort of understanding. Even those like Activia commercials we used to see in the 2000s, right? Like eat your Activia and you'll have the best gut bacteria. We know that there's bacteria in our bodies. We generally know that they're in our guts. But we used to think that the uterus did not have bacteria. However, within the last decade, they've actually discovered that that's not true. And research confirms that there's actually a microbiome in the uterus similar to the microbiome that we have in our gut. And when I say microbiome, I basically just mean a bunch of different bacteria that are supposed to be there when we have a healthy microbiome. These are the bacteria and the ratios of bacteria that we want. When we have a dysbiotic microbiome, we are now having overgrowth of bacteria that maybe are there natively, they're supposed to be there, but in smaller amounts, or we're having overgrowth of bad bacteria that shouldn't be there. The balance of your own unique microbiome is what can impact positively or negatively your fertility journey. So we care about this because what research is starting to uncover is when our microbiome is dysbiotic or imbalanced, we are seeing more inflammation in the uterine lining, in the endometrium. We are seeing recurrent implantation failure, and we are seeing recurrent miscarriage. We don't want these things, right? We want babies. We don't want suffering. We don't want loss. We don't want reasons to be blocking a perfectly good embryo from doing its job. And especially looking and digging into how, which we're going to talk a little bit about today, how the microbiome impacts the embryo's ability to implant is super fascinating. Like, preparing for this episode and just doing a bit more research actually made me think, oh my goodness, this is 10 times more important than I ever thought it was. So if you're sitting there going, I'm doing everything I can, I'm doing all the things and nothing's working, this might be an area to navigate and investigate and ask questions around. Some of the research does show us that 10 to 30%, we don't have great data here, obviously, of women who are dealing with infertility also have chronic endometritis. So endometritis is basically when you have a uterine lining microbiome inflammatory issue. Very, very underdiagnosed in the fertility space. Why? Because it's likely not being assessed for until you're deep into failed IVF. 30 to 60% of women with recurrent implantation failure in IVF cycles have been diagnosed, well, in this one study, I shouldn't say all, were diagnosed with chronic endometritis. That's potentially half of women that were having non-successful euploid embryo transfers, having them not work, were actually then found out to have microbiome issues. 66% of women in this one paper who had recurrent pregnancy loss also had microbiome issues. These numbers are huge, which is why I sit here and I say, we don't need to wait to do assessment. We don't need to have failed IVF to deserve to look into this as a potential option as to why it's not working for you. Oftentimes, when we're talking about microbiome issues or chronic endometritis, there are no symptoms. The symptom is infertility or miscarriage. There isn't pain, swelling, those types of things that are like alarm bells, something's wrong. It's silent, right? The only thing I will say is that this is something when someone has a lot of spotting and nothing else is coming up, we know there's no fibroids or cysts or polyps or anything. We know progesterone is good and thyroid is good and all the stuff, all the other things, we're checking all the boxes. This is something I'm like, I have seen chronic endometritis cause excessive spotting. But for the most part, we're not getting any sort of warning or symptoms from this. In terms of the environment that we want, we now know that the uterus is rich in lactobacillus, which is a fairly dominant organism in our guts as well. And when you're picking up a probiotic from drug food stores, from health food stores, drugstores, wherever you're getting your probiotics, they're mostly lactobacillus with some bifidobacterium, and some others have others in them, but those are kind of the two main strains. So we know that the uterus is highly a lactobacillus dominant environment, and that is what makes it receptive for implantation. They do find in research that women with a non-lactobacillus dominant microbiome are more likely to experience implantation failure and miscarriage. So again, it's about the balance of the microbiome. Everyone is going to have other bacteria. There's going to be a little something of other things in there. Streptococcus and Gardnerella is a common one we see, or Portobello. You're going to have a little bit, but the little bit is fine. It's about the overall balance of all of the bacteria. Lactose are important, like we said, for implantation, but also for early pregnancy as well. Implantation itself, it causes a shift in the immune system. And this cannot happen if the endometrium is already inflamed and there's a large amount of inflammatory cytokines already kind of like doing damage, essentially. It causes an even stronger imbalance in that Th1, Th2 shift that we need to see in early pregnancy for implantation. And it keeps the immune system from being able to go back and forth in those early weeks of embryo development that we need to maintain pregnancy. So again, early losses, potentially that inability of the body to shift out of the autoimmune dominant immune response and shift back into the don't attack everything that you see immune response. If we can't do that, then of course the body's going to start attacking the embryo. A low lactobacillus state creates this pro-inflammatory environment. We can all agree that inflammation is not good, right? In the uterus, whether or not we have all the data, we have all the research, we understand it completely. We don't yet. And I think this is a very misunderstood piece of the infertility puzzle, but it also logically makes sense that this is not a conducive environment for making a baby. I am obsessed with Friends. I pretty much watch it every day to help my body wind down. It's my show. It's my comfort show, right? And so I always think about when Monica and Chandler are going through their infertility struggles and they go to the clinic and, they run into Janice and Chandler has to go do his semen analysis. First and foremost, if your husband watches that, know that that's, those creepy rooms are not what it's like anymore. Just go get tested done. You get to do your sample at home, but that's my sidebar for today. And they find out from all their testing, they basically just say that like there is something wrong with Chandler's sperm, but that Monica's uterus is an inhospitable environment and very well could have been this that they uncovered, because that's like probably one of the best ways to describe it. Is it just creates this inhospitable environment from an inflammatory angle, from a immune angle, and all of these pieces are stuff that isn't going to come up on your run-of-the-mill lab work. So we do talk about, I'm going to talk about some of the testing here. We do talk about some of this more like advanced maneuver testing, the stuff that we maybe want to look into if you've been told you have unexplained infertility and you've had a bunch of blood work done and everything looks normal, everything's all good. We do talk about where we go from there inside Fertility Confidence Method, obviously, but also inside Labs 101. It's $17, you guys, ttc.kelseyduncan.com/fertility-labs. Actually, is there a dash? I don't know. I'll put it in the show notes, but I highly recommend going and checking that out if you're like, what labs do I need to do to understand if this is maybe something I need to investigate? The other piece with lactobacillus is it's also actually really important for breaking down the endometrial layer to assist with implantation. So something that I never really considered is actually the act of implantation. It's not just this like sticky little thing that is just there. It needs to burrow in to the endometrial layer, similar where the sperm needs to actually burrow into the egg. That acrosomal reaction to break down the outer layers of the egg so that the sperm can get in and fertilize. That's a very important step. As now we have this embryo moving in, binding to the lining, we need that lining to be able to let that embryo actually in and implant. And so the lactobacillus environment, it promotes proper prostaglandin production, which is actually an inflammatory cytokine. Some inflammation is good, guys. We don't want to get rid of all of our inflammation because there's inflammatory processes through the menstrual cycle and through fertility that we need to happen. It's again, all about proper balance. So we need some, but we don't want a ton. The low levels of lactobacillus has also been associated with higher levels of IL-6, which is a pro-inflammatory cytokine. And we've seen research in the recurrent pregnancy loss state showing that women with recurrent pregnancy loss have higher levels of IL-6 in their bloodstream. So we're starting to just see, again, the research is small, okay, you guys? I'll be perfectly honest. The studies, they're not awesome. We need larger, bigger studies. We need companies to pick this up and really dig deep into it. But we're starting to see a bunch of little dots being connected that when I'm sitting with a couple inside Fertility Confidence Method who have been told they have unexplained, maybe they've had multiple miscarriages, they don't know what's going on, their clinic wants to do IVF, but they want answers. This, without a doubt, is the first thing we're going to investigate. Because especially if we're like inflammation, you have lots of signs of inflammation. They could also still have this that's contributing to the inflammation. And so we want to take a whole body, whole couple approach. And I would argue that given that we're looking at the uterine microbiome, it's not even whole body. It really is very local to that reproductive system, but we are potentially seeing a trickle-down effect to inflammatory signs or immune dysregulation signs in other areas of the body that might point to us to say, hey, we should probably look into this a little bit. So like I said, it's all about balance, right? So we want good amount of good bacteria. You're all going to have some bad bacteria. We just don't want an overgrowth of bad bacteria. So when we have those high levels of bad bacteria and low levels of good bacteria, that's what we call a dysbiotic environment. Because the lactobacillus actually helps create a healthy vaginal pH, it also produces something called lactic acid, which protects the endometrial layer, helps protect the vaginal canal and keep that good pH environment. That's going to keep the bad bacteria from being able to flourish. So if we don't have good levels of lactobacillus in our vaginal canal and our pH is disrupted, and let's say your partner has some overgrowths in his semen and you're having unprotected sex, we're now introducing other even if he doesn't have overgrowth, let's say he's a great microbiome, we're still introducing a different microbiome into our body. And if you don't have that good, healthy pH and that protective piece, then your body's not able to fight that off. And maybe it's not a one-time thing where now all of a sudden you have this dysbiosis, but over time of intimacy with your partner, especially if you're TTC and it's unprotected, that is going to add up to potentially causing that dysbiotic environment. So we're not going to get into too much about like the partner side of things, but know that this is a piece for them as well. And we do have a podcast episode talking about about the semen microbiome and how that matters for men. I'll make sure we link it in the show notes. But if we do find that you have a microbiome that needs support, your partner's also probably does as well, right? So like I said, our standard kind of fertility workup, we're not looking at these things, unfortunately, right out of the gate. My hope is that in my lifetime, when couples walk into the fertility clinic, this will be run-of-the-mill testing for them. I really do think it would actually save a lot of time and money to sort this out before, doing 3 IUIs that don't work, and then an egg retrieval, and then 3+ embryo transfers, and then saying, why isn't this working? And finding out that you have no good bacteria and an inhospitable environment for implantation. Like, if you could save yourself $30,000+ plus all that time is probably 6 months to a year, essentially, depending on how quickly you're moving through the process. Like, wouldn't you? Doesn't that make sense to actually support your body's ability to carry a pregnancy and optimize your body's ability to carry a pregnancy before investing in the ART? And it's not a knock against the ART. A lot of my clients use IUI and IVF. I'm all for it. If it suits your life and what you need and what your body needs for support, great. But what I don't support is jumping into those medicated cycles and expensive and invasive cycles without actually doing due diligence to rule out all potential reasons as to why you aren't getting pregnant. A small study, 200 women, found that 55% of women who had been diagnosed with unexplained infertility had ureaplasma in their uterus. At a 6-month follow-up after treatment, so they gave antibiotics only, they didn't do anything else, they found 42% of these women were pregnant. So over 100 of those women had chronic endometritis, had a uterine microbiome disruption. And then after they treated them, nearly half of them went on to get pregnant within those 6 months without intervention. I think that's really cool. Another small study, 100 women, they split them into 2 groups. One group had unexplained, the other had infertility, but had a diagnosis for that infertility. And they found that 32% of the women who had unexplained infertility had ureaplasma in their uterus. Only 8% of the women who had a fertility diagnosis did. So that's not to say if you have PCOS, if you have hypothyroidism, if you have a reason as to like a code as to why they think you're not getting pregnant, that doesn't negate the fact that you could also have a microbiome issue. But I think this is a really interesting, like 1/3 of the unexplained actually had some sort of dysbiosis, and less had obviously it in when they had a diagnosis, but not 0, right? The good news is it's fixable. And I've seen this time and time again over the last couple of years that we've really started investing in this type of testing, is women from all walks of their journey treating and getting pregnant, whether they're getting pregnant unmedicated or whether they're stepping back into IVF and being successful there. It's something that is fixable. It's not always easy. Sometimes it takes time, but some things to think about right now in terms of, okay, you're not going to have this answer for you in the next day or 2. How can I support a healthy microbiome in my body starting today? Here's a few things I want you to consider. First and foremost, you should never, ever, ever wash your vulva with soap or use any of those like fancy washes or anything like that. The ads that are like, don't smell down there, guys. Okay, you're supposed to have an odor. It's fine. If your odor is very, very strong, offensive, and fishy, please go and get some swabs done. But we should not be introducing any sort of soap that is going to be altering the pH of our vaginal canal. Really, really important. Just water and a soft cloth, okay? You're also not going to want to use any non-fertility friendly lubricants because they're not typically balanced for vaginal pH. Our fertility friendly lubricants like Baby Dance and Good Clean Love Bioessence are made specifically to not alter the pH environment of that vaginal canal. So that's another really important piece. Sidebar there in terms of lubricants too, like if you're just using a conventional lubricant, make sure it doesn't have spermicide in it, you guys. Some of them still do. So I would hate for you to be trying to get pregnant, but using a lubricant that's actually killing the sperm. What a silly thing, right? So just make sure you're using something that's safe for fertility. Also, we want to talk about lowering our sugar intake. Sugar can cause and feed bad bacteria. So if you're already teetering on the edge, that can impact things. We want to increase fiber because our gut health is important. We are getting some of our vaginal and uterine bacteria from our gut. So having a good lactobacillus environment in the gut is going to help support a good lactobacillus environment everywhere else. We want to try to avoid or limit those high inflammatory foods. So if you have foods that you eat that cause a lot of symptoms, especially gastro symptoms, your body's probably not digesting those all that well. Something to consider in terms of just lowering all of your levels of inflammation. Alcohol consumption disrupts our flora, creates actually fuel for the bacteria. Again, you know me, I'm not an all or nothing person. Do I think you need to be 100% alcohol free to get pregnant? No, I don't. But something to consider in terms of looking at your overall consumption. Obviously, if you've used frequent antibiotics in the past or present, that is going to disrupt your microbiome. So something to consider. Our lactobacillus wants and needs glycogen for fuel. So our vaginal lining, it actually stores glycogen, and then the lactobacillus ferments it, creates lactic acid, and that's what helps maintain that pH environment that we're talking about. We get glycogen from carbohydrates. So people who fast for prolonged periods of time, have a low carb or ketogenic diet or carnivore diet, those are people that are not going to have good, healthy levels of glycogen available to help the lactobacillus survive. We need that for fuel. High intensity exercise, then not fueling back with the carbs that your body needs after that is important. Having chronic stress or significant caloric restriction, food is important because our food is what essentially helps to fuel and maintain that good, healthy environment. So some food for thought, some things you can start thinking of. But if you're sitting there going, okay, tell me how to test. Tell me how to test, Dr. Kelsey. I'm not going to gatekeep that for you here because I think this is a really important conversation. There's two different avenues that you can go down and then a third avenue that I'll mention as well. So gold standard being our clinic testing, which is an Emma Alice biopsy. They actually go in, they take a little piece and they test for various types of inflammatory cytokines as well as good and bad bacteria. Actually, I'm not sure if you need to do Receptiva with that Emma Alice to get the inflammatory cytokine, so don't quote me on that. Those two tests sometimes go hand in hand together. It's completely up to you. We do talk about the Receptiva test in the Endometriosis Unexplained Infertility episode as well, if that interests you. So you can go back and check that one out. But the Emma Alice is the one that specifically looks at the bacteria. Some clinics don't offer this. Other clinics typically don't offer it until, like I said, you've had failed euploid embryo transfers. So if that's your case, when you're asking for this type of support, there is another at-home option that you can order. It's through a company called Fertilysis. They offer a few different types of really cool advanced maneuver testing, but we recommend the full female microbiome. If you actually use the code FCM at checkout, it'll get you 5% off that test specifically. And you you send in a menstrual blood sample as well as 2 vaginal swabs. So you get to see your uterine via menstrual blood and you get to see vaginal canal health as well. And what's really cool is that they will also give you treatment recommendations at the bottom based on what they find in that test. So those are the 2 options that we have our clients in Fertility Confidence Method seek out when we're thinking that this might be a piece or a factor for them. The third option is to just do a vaginal swab. It's not going to be the same. We can assume Similar bacteria that are in the vaginal canal are also in the uterus, but just if your vaginal swab comes back clear, it's not a guarantee that the uterus is good as well. But it's better. It's a good thing to try at the beginning. The Emma Alice, the Fertilysis testing, it's an investment. So if that's not on the table for you at this time, then the vaginal swab, something like Evie, is an at-home product. Your doctor can also do a ureaplasma mycoplasma swab when you're doing a PAP, where you can go in and ask them to do that extra. There are some options, but just know that it isn't quite robust enough for us to say the microbiome is good, but it could be a good place to start. If we see that your lactobacillus is low in your vaginal canal, it's likely lower in your uterus. And so starting to work on that essentially. Hopefully this helps you start to kind of think and wonder and ask some different questions around how this might be impactful for you. As always, we're here to support you. If you're like, Kelsey, this sounds excellent, and I know I need help with this, and advocating and giving me a treatment plan, Fertility Confidence Method doors are open for you. You can schedule your clarity call. We'll get to know you a little bit better. Make sure that this is a good fit for you. I'll pop the link down in the show notes, but it's just downloads.kelseyduncan.com/results. And we'll build you out a personalized care plan, but we'll also give you all of the hands-on support, one-on-one coaching, training, everything that you need to build out your dream family. We become a team. We're with you until you don't need us anymore. And it's a really fun community to come in and just get all of your questions answered, but more importantly, get the support that you're maybe not getting from your current care team. And this is an area that we have a lot of experience and expertise in terms of navigating, and have definitely seen a very interesting trend of treatment resulting in pregnancies, which is really, really fun. And it's obviously what we want, right? We don't necessarily just want a healthy microbiome. We want to make babies, and we want to lower risk of miscarriage. And this is definitely a piece, if you are having recurrent loss, that we absolutely, especially loss under that 6-7 week mark, that we want to be looking into. So hopefully you learned something today. I'll put some of those extra notes in the show notes for you guys, and I will see you in the next episode. Take care.